So fibromyalgia and foods to avoid. So this could be a tricky subject. I'm going to try and make it as non-tricky as possible. When you ask me, and this comes from questions that have been asked about what foods do I avoid, the caveat is there's no one silver bullet diet, and that can get a little involved. If I'm in a conversation with somebody and they're like, well, I can't, I'm not going to be able to, see you, or for whatever reason, I'm somewhere and somebody's having an issue and they don't know anything about me, but they kind of know that it sounds like I know what I'm talking about, and they'll say something like, okay, what's the one thing I can do? Or sometimes I'll have patients that they're going to start care, but it's going to take maybe a month or two or three before they can start. They'll say, well, what can I do in between time? Then I will get into the foods that you could avoid and see what happens. Because that could be diagnostic for me. By the time they get here, they could have a mild improvement, they could have a dramatic improvement, and everything else in between. And that helps me to understand their case better. So foods to avoid for fibromyalgia. Most fibromyalgia patients have autoimmune problems. And I would say 75% or more of the fibromyalgia patients that come in here have Hashimoto's thyroiditis. So you may or may not be in those categories, but I'm just kind of throwing that out there based on what I'm about to say. So specifically for autoimmunity, which most people who have fibromyalgia have autoimmunity, specifically the classics, like I have one friend who's a very well-known neuroinflammologist. He's written a number of books and stuff. He'll basically take you off of gluten and milk products. That's it. He'll say, get them off of gluten, milk, and see what happens. Gluten and milk are by far the two biggest natural irritants to creating immune inflammation. Gluten way more than milk. Now, when we started out, it was years and years ago when we didn't know anything about anything other than food allergies. We weren't even looking at sensitivities back then. It was gluten, milk, corn, soy were the biggies, and so we would take people off of those. And so it's casein products, which kind of transcended milk a little bit, gluten, soy, and these were the biggies. Since then, soy has kind of gone down, corn has kind of gone up, kind of goes back and forth. But those are the big ones. Now, if you are fibromyalgia, you could also try a trial of getting off of lectins, or you could also have a trial of getting off of nightshades. Specifically more for and there's more, but specifically for the fibromyalgia patient who has Hashimoto's. And if you're a fibromyalgia patient and you have hypothyroidism and you haven't been told you have Hashimoto's, just for the record, the chances of you having Hashimoto's is probably about 90 to 95%. So this would apply to you. So you could try those food groups. Those would be foods that you can try because as you're picking up, it's not like you read on the internet, Dr. Google. It's like, okay, you get off I forget the one guy's name who I should not forget it every time I look for something. He's got a commercial on about getting off of lectins, and it was a miracle, and he lost all the weight. And that happens for some people. And for other people, they get off the lectins and nothing. Okay, so and there's a variety of reasons for that, but these are the foods. And then the last thing, there's food sensitivities. We really can't get into that because those are a challenge to determine. So if you're doing like gluten, casein, soy, corn, you're getting off the lectins. Some people would say gluten and all grains. It's another. I'm giving you. I know you'd like a specific. I get that. It's the way it is. Just trust me. This is like part of what people pay me to do for. So sometimes you go. Sometimes it's like gluten, milk, and all grains. And I mean, and I'm serious. You should write this down because these are the keys to the kingdom. It's just not the same key for everybody. And then I like to include sugar with this. So if I were going to go down to the minimum 3, let's say, I'd probably be more inclined to go gluten, casein, and sugar. And if you have Hashimoto's, I would probably be inclined to say shellfish, because shellfish have a lot of iodine in it, and it'll tend to blow up people who have Hashimoto's, and then that'll blow up your fibromyalgia. Sugar's huge. I am not going to get into it. I could talk about sugar for like the next 5 hours, but because it's so much around us, we think it's okay. I think most people have gotten that like Diet Dr. Pepsi is not like something you should be drinking like ever, but at least not like once a day. If you're sick, if you have these types of problems, if you're watching this video, like you should not be drinking sodas. You should not be eating sugar. Sugar, somebody told me that we used to eat 2 pounds of sugar a year, and it was kind of a confection. In other words, it was like for like a special occasion, a birthday, it was something like that. And now we're eating like 2 pounds of sugar like a week or something like that. And your body doesn't need sugar, frankly. You get sugar, whether you realize it or not. Everything you eat breaks down into what's called glucose. All of your cells use glucose to make energy, all of them. Every food you eat, whether it's a steak or whether it's a vegetable, it breaks down into glucose. So you don't need sugar, okay? Sugar creates massive inflammatory responses. It causes swings to go up and down like this. People come into me with fibromyalgia and are like, I got all these pains and it's sensitive, and they told me, I was gonna have to live with it. And a lot of the muscle pains that the person experiences is blood sugar swings, because your muscles use like half the blood sugar that goes in there. So now you're eating sugar. Your insulin, which gets the sugar in the cells, is going like this, and you're getting mood swings, and you're like going like, I'm so anxious, and then I'm like this, then I'm like that, then I'm like this. That's sugar. When you have things that come and go, when you things have symptoms that are going up and down, most of the time it's blood sugar swings. Okay, where does that come from? It comes from eating sugar all the time. Your body isn't designed to handle that much sugar. If you're going to eat dark chocolate because it's so wonderful for you and it can be okay, little piece. Not like, ooh, dark chocolate's good, let me eat the whole dark chocolate bar, because it's good for me, so I can do it. No, it's not, because that's too much sugar. So you really should be getting your sugar from natural sources. So it goes back to the old boring stuff like, meats and vegetables. And for a lot of people coming here who are sick, not even a lot of fruits. So that's kind of like the skinny on like, what foods should I eat? As you can see, you could get into a lot more specificity with that, especially when you start throwing food sensitivities in there. So if you're going like, look, dude, I can't, I'm not gonna, I just want to know, like, just give me a couple foods. I'm like, okay, gluten for sure, casein for sure, which includes milk, cheeses, a lot of other things that you can look into that. And then I would go sugar. I would go sugar because all of the other ones are variables. I have people who can eat corn. I have people who can't eat corn. Milk, even some of the time people can do milk, but most of the time it's not a good thing. Gluten, milk, sugar, all of those three, that's money in the bank. Those are things that you should not be eating. And if you get off of those and you don't have a positive effect, it's not because you should be eating those. It's because you got so many other things and you're eating so many other things that are affecting you, or you got so many other food sensitivities that you can't even tell that that you're feeling better from doing it. But I would stop those three. And period. Whether you felt better or not, trust me, if you have fibromyalgia, if you have Hashimoto's, if you have chronic conditions, if you have those types of things, stopping those three is going to dampen inflammation. It's going to dampen immune responses. It's going to be beneficial to you. And eventually, as you try other things, it's going to help those other things to work better.